Baby position in the womb. Types, importance and what to expect during pregnancy. The position of the baby in the womb plays a crucial role in determining the ease of delivery. As the pregnancy progresses, the baby moves and shifts positions, but the final position near delivery can impact labor and birth. Types of baby positions. 1. Cephalic, head down, position, ideal for birth. The baby's head is down towards the birth canal. This is the most common and safest position for vaginal delivery. Variations include occiput anterior, OA, baby's head is down, facing the mother's back, best position. Occiput posterior, OP, baby's head is down, but facing the mother's belly, which may cause back labor. 2. Breech position, feet or buttocks first. The baby's feet or buttocks are positioned toward the birth canal instead of the head. Types of breech positions. Frank breech, baby's buttocks are down with legs extended upward. Complete breech, baby's buttocks are down with legs bent. Footling breech, one or both feet are positioned to come out first. Breech babies may require C-section delivery in most cases. 3. Transverse lie, sideways position. The baby is lying horizontally across the uterus. This position is not safe for vaginal birth and usually requires a C-section. 4. Oblique position, diagonal position. The baby is at an angle inside the womb. This position often shifts into a head down or breech position before labor begins. Why baby position matters. 1. A head down, cephalic, position is the safest for vaginal delivery. 2. Breech or transverse positions can lead to complications, such as prolonged labor, cord prolapse, or difficulty in delivery. 3. Some positions may cause back labor, intense lower back pain, during childbirth. When do babies settle into position? 1. By 28 to 32 weeks, babies are usually active and can change positions frequently. 2. By 36 to 38 weeks, most babies settle into a final head-down position. 3. Some babies remain in a breech or transverse position until late pregnancy. Ways to encourage head-down position. If your baby is not in the ideal position by the final weeks, you can try checkmark prenatal yoga and exercises. Certain positions like pelvic tilts may help. Checkmark sleeping positions, lying on the left side with a pillow under the belly. Checkmark chiropractic care. The Webster technique may help realign the pelvis. Checkmark external cephalic version, ECV. A doctor manually turns the baby from the outside, done at 37+ weeks. What if my baby is in the wrong position? 1. Doctors may recommend exercises or ECV to turn the baby. 2. If the baby remains breech or transverse, a C-section may be necessary. 3. Some breech babies may be delivered vaginally if conditions are favorable. How to turn a breech baby naturally. If your baby is in a breech position, feet or buttocks down, after 32 to 36 weeks, there are some natural techniques that may encourage the baby to turn head down, cephalic position. Checkmark 1. Forward-leaning inversion, spinning baby's technique. 1. Kneel on a couch with your hands on the floor and keep your hips elevated. 2. Hold the position for 30 seconds to 1 minute, then slowly return to a sitting position. 3. Repeat 3 to 4 times a day to help shift the baby's position. Checkmark 2. Breech tilt exercise. 1. Lie on your back and elevate your hips with pillows. 2. Hold the position for 10 to 15 minutes, 2 to 3 times a day. 3. Helps use gravity to encourage the baby to move head down. Checkmark 3. Pelvic tilts, cat-cow exercise. 1. Get on your hands and knees, arch your back up, like a cat, then lower your belly down. 2. Do this for 10 to 15 minutes, twice a day. 3. Helps create space in the uterus for the baby to turn. Checkmark 4. Walking and belly dancing movements. 1. Daily brisk walking encourages movement. 2. Gentle hip circles and swaying, like belly dancing, can help the baby rotate. Checkmark 5. Using a warm and cold compress. 1. Place something warm near the lower belly and a cold compress near the top. 2. Babies may move toward the warm. Checkmark 6. Playing music or flashlight method. 1. Place headphones with calming music near the lower belly. 2. Use a flashlight to shine light near the pubic bone to encourage movement toward the light. Checkmark 7. Chiropractic care, Webster technique. 1. A trained chiropractor can use this method to align the pelvis and give the baby more room to turn. Medical option. External cephalic version, ECV. If natural methods don't work, your doctor may attempt an ECV around 37 weeks. Checkmark. The doctor applies gentle but firm pressure on your belly to turn the baby manually. Checkmark. It has about a 50 to 60% success rate. Checkmark. Usually done under ultrasound guidance. Checkmark. If successful, it helps avoid a C-section. When is a C-section necessary for a breech baby? 1. If the baby remains breech or transverse at full term, after 37 to 38 weeks. 2. If there are complications like placenta previa or umbilical cord issues. 3. Some doctors allow a vaginal breech birth, but it depends on the baby's position and your health. Final tips. Checkmark. Start natural turning techniques early, before 36 weeks, for better success. Checkmark. Stay hydrated and active. Movement encourages baby positioning. Checkmark. Check with your doctor before trying exercises, especially if you have complications.